Welcome. Welcome to the number one strategy that I used to stop snoring and wake up rested without using meds or machines. So I've put aside, and I hope you put aside, an hour of your time to spend with me going over this exact topic. So you're here because you want to know how to stop snoring. So it is super important that you just block out all the distractions that might come your way over the next hour. Okay. Put your phone away, put it on silent, put it in another room, anything that you can do to take this undivided a time for you, because it's so rare that we give ourselves the time for something like this. Okay. Um, I am a coach, so one of my main things is the accountability aspect. All right, you're 70% more likely to reach a goal with a coach because they're going to tell you the things that you don't want to hear, right? We're always accessible at all times. I really want you to make this a time that you aren't. Okay. Um, and if you can do this, I should also just put it out there that this is a baby step in reaching your goal. So let's start off on the right foot. Okay, so here's my promise for you today. By the end of this training, I will show you how to stop relying on products and appliances to improve your sleep and how you and your partner can wake up feeling rested the next day. So hopefully that sounds good. Another thing specifically, we're going to discover why what you have been doing for years hasn't worked. And I'm going to walk you through something that does. So imagine being able to skip over all of the Googling and the trial and erroring and just do what works. I know that when I learned the process that I'm going to share with you today, it certainly changed my life. And it's changed clients' lives as well. And I know that it can change yours too. Okay, so before we dive in any further, let me know if you can relate to any of these. Are you tired of waking up tired despite taking sleeping meds and supplements? Are you fed up with sticking things on or up your nose or over your mouth every night just to help you sleep better? Are you wearing a night guard because of sleep related grinding, but still waking up exhausted? Are you unsure how to get a peaceful night's sleep without disturbing your loved one or being jolted awake from your own gasp or like gasp for air or an aggressive snore? And do you maybe feel embarrassed, guilty, lonely? You're not alone if you can relate to any of these. Okay. That's probably one of the most important things that I want to say is you are not alone, and be kind to your mind because it's not your fault. Okay. Um, if you are someone who has like, yes, 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 don't worry, I'm not a stalker. I'm not watching you and pointing out all of those things that you're experiencing. Um, I'm just putting it out there because these are the most common things that people come to me complaining about and wanting to change. Okay. So I also want to say that whatever it is that you're doing and it hasn't been working for you, it's not your fault. Okay. Um, it's really hard to understand like what to do out there and who to trust, really. If you feel anything like I did back when I was exploring what I'm going to share with you today, um, you would just know that I would do anything to try to change how I was feeling back then in order to help improve my memory, my mood, my relationships. Um, Unbeknownst to me that it was snoring in the first place. So now, finally, there is a chance for you to see some kind of change too. Okay, you can wake up feeling energized and ready to tackle your kids, your spouse, your job. You don't need to rely on sleep aids and products to help you sleep. You can sleep throughout the night without being shoved by a partner to wake you up. And you'll be able to stop feeling guilty for disturbing a partner's sleep or embarrassed when traveling with friends or family. you really can finally feel rested. Okay, because what I'm going to share with you today, it's the fastest and the simplest way to stop snoring so you can wake up feeling rested, both you and your spouse, actually, because that can help make all the little challenges in a relationship a lot easier to deal with. Okay, so a little bit about me. Um, I'm Tiffany Ludwicki. I am a health coach with a background in myofunctional therapy and dental hygiene. I'm the founder of Ludwicki Wellness, Mind, Body, Mouth, and the Stop Snoring Solution. I specifically support individuals who snore to help them improve their sleep, energy, and their personal relationships. I'm also a mom, a wife, a friend, and an entrepreneur. So, this was me um, only 5 years ago when I masked my insecurity by surrounding myself with bad habits. Okay, my relationship was struggling from waking up to an irritable, sleep deprived partner and my own midday fatigue just increased the exhaustion that I was feeling, and it was becoming harder and harder to ignore. I thought my ability to sleep anywhere and everywhere was actually a superpower. I remember one time, actually years ago now, just after high school or before high school, I fell asleep. I was snoring during Saving Private Ryan. So if you don't know that movie, it is a very loud and graphic war movie. And I also have many occasions where I fall asleep just mid conversation with friends. And so even when I'd have waking moments, my memory as a result was very, very poor. And I'd feel so embarrassed not being able to recall events. Um, so much so that I became really anxious going out in public and seeing like the same groups of people at conferences or events because I couldn't recall our previous encounters. Um, and also, if I'm being completely honest, I couldn't understand why I never learned from my mistakes. I always felt like the bad guy having the same conversations and the same fights with my partner over and over again. Okay. And so when there's more conflict paired with a low libido, which I didn't know was related to sleep, it just adds more stress on a relationship. And now I know that my snoring was like seriously ruining my life. Back then, I was tired, I was confused, I was feeling defeated, like a bad wife and a failing mom, and I decided no more. There had to be a reason for all of this. See, it was actually my baby who made me come to this realization. She wasn't sleeping well. She was snoring, and she actually ended up getting diagnosed with sleep apnea. It wasn't because her tonsils and adenoids were bad. So having a surgery to remove them wouldn't help her. And CPAPs, mouth tape, and appliances are just not options for babies. So I decided that I was going to figure out how to stop snoring without all of that stuff. And it didn't matter how long it took me. I knew a little bit. So I guess the reason I had the confidence to even explore this is I knew a little bit about this modality in dental hygiene called myofunctional therapy. It had to do with sleep. And so I enrolled in the therapy as opposed to just referring the people that I saw with the symptoms and the signs out for a sleep study. And then without even realizing it at the time, I would resolve my own problem that I didn't know was there. That was snoring. So the decision led me to figure out what I had been doing for my physical and mental health for all those years was just completely wrong because I never addressed my sleep, my root cause. My decision to help my baby made me aware of my snoring that was actually silently killing me and my marriage. And that's when I started the journey to that got me here today. Um, Here sharing my methodology so that you can skip over years of trial and error and struggle that I went through. So you can wake up rested, rebuild intimacy with your partner, look forward to camping and vacations, and just living a healthier, happier life. Okay. I know that I'm so grateful that I made the decision to invest in my family because it taught me to invest in myself. Okay. This really is the only vehicle that we're going to have. And so we have to do the maintenance that it deserves. I'd probably still be snoring and probably trying nasal strips by now and more dental appliances and even dieting and exercises that were just not going to get me anywhere. And so, like Oprah says, when you know better, you do better. So, even though I'm now able to stop mouth breathing and stop snoring all night long, it did take me a bit of time to figure that all out because I didn't know that was my actual problem. And then once I learned that, I realized I had to unlearn behaviors that to me I thought were normal. I then tested out different appliances and products to see which ones worked for me and which ones didn't. Most didn't. And it took a lot of time and patience. And there was no way I could have arrived at the methodology that I have now discovered without investing in my professional education and becoming a leader in my field. I knew now that I was fully committed and I was not going back to my old ways. So, what I discovered through all the trial and error was that falling asleep anywhere and everywhere was not normal. Okay. My inability to retain info wasn't because I was stupid. I figured out that I had an anatomical issue and a bad breathing habit that was at the root cause of my problem. And once I started to address that root cause, everything changed for me. And what I want to share with you today is how you can skip over all that trial and error so you can get a better night, quiet night, sleeping and waking up rested. Okay, so some of the info I'll be sharing now will be known to many of you. Some of it will expand your current knowledge, and some might even just blow your mind. I'm excited to explore this concept together. But before I do, um, I wanted to share this case study with you. Okay. This is my client, Daniel. He would very rarely wake up feeling rested. He had difficulty concentrating. He would clench and grind his teeth, suffer from body pain and ringing in his ears. And despite seeing healthcare practitioners, engaging in mindfulness practices, and performing physical activity, he was becoming more anxious and depressed over his ongoing and worsening problems. So after Daniel went through my program, he stopped snoring. He also noticed his debilitating pain and the ringing in his ears had resolved. He experienced more energy and focus and even pursued a certification in a healing modality that he was passionate about. So now imagine you no longer snored. You woke up with energy and a passion for life again. You were more patient and loving with your partner and your children, and you could feel your anxiety melting away. Your blood pressure was dropping, your body pain resolving. You started to illuminate a more youthful appearance, and you even dropped some extra pounds that you were carrying. Our sleep affects so many aspects of our life, and snoring is just getting in the way. So, the concepts that I wanted to share today, one, the real reason why whatever you're trying isn't working, and different actions that you thought might be your root cause for why. Two is how to stop the sleep roller coaster. And three, the discovery that I made that's changed everything for me and why I want to share this information with you. So, concept one, it's broken down into three parts. Okay. So, what we're going to start with first is, what is out there right now. I'm going to share the most common things that people use. And then we'll get into maybe why you think you might snore and what the root cause is. Okay, so Band-Aid solutions or current treatment protocols. Okay, we're going to go over a little bit about the pros and the cons. So, sleeping pills. They help you fall asleep faster, so you have a perceived beneficial effect. Okay, wonderful, right? Well, maybe, but temporary. So if you're dealing with a time change from travel, maybe a stressful or a traumatic event, then yes, wonderful. Okay. Otherwise, wrong. They might not be working for you. They negatively affect your sleep cycles. They reduce your REM sleep. And since they don't actually allow your body to get into the deep stages of sleep that are required for brain and body detoxification and restoration, they can actually make you drowsier in the morning and decrease your emotional and mental resilience. Okay. Not to mention, they can become addictive. And all doctors, I should say, um, that discuss pharmaceuticals for sleep, they state that they are short-term use. Okay. However, it is often overlooked and it's not monitored, unfortunately, by some physicians and pharmacists. And so long term use does become a common trend in our society. Another thing is nasal strips and dilators. There's different brands like Breathe Right, Flare, Mute, and they work by opening up your nasal passages or just pulling on the skin and keeping the cartilage open. Okay. If your snoring is from an allergy or a sinus issue, then those strips might not be beneficial because your root cause is actually inflammation. Okay. So addressing that is probably going to be your best course of action. If they do work for you, it could be because of some type of structural issue, like a deviated septum, injury, or a narrowing of your nasal passages, or maybe just muscular weakness in the nose. So, if they work, then that is great, but just be cautious though, because they may help you feel like you're breathing better, but they could be hiding a deeper concern like a sleep disorder. So, regardless if you're snoring, I would always suggest getting a sleep study to rule out anything that could be more detrimental to your health if untreated. Oral appliances. So, some devices that are made by a dentist out there, they work by either keeping your airway open by pulling your lower jaw forward or potentially holding your tongue out of the airway. Others, like night guards, bite planes, there's different terms for them. They actually only protect your teeth from the grinding wear that occurs in people who snore, okay, or that have sleep issues, sleep apnea especially. So they can improve your airway space, but close-up follow-up is needed to ensure that it's a successful treatment, and that the device doesn't change your teeth or your bite. Okay. If you already clench and grind is a symptom of your snoring issues, you might be wary of um, changing more oral and facial structures that are already there. Okay. However, they can be a great option for people who snore. Don't suggest the over the counter version ones, though. A lot of people end up with a lot of jaw issues because of those ones. All right. And then for the bite plane and night guard, which I mentioned, the one for protecting their teeth, they're only about 50% effective. So if you're someone who has one and you wake up and you find it across the room, then you likely have an airway issue that's undiagnosed. Okay. So treating that root cause is your best option. Um, However, if it works for you and you're not snoring or having other issues, then great, you're protecting your teeth. It has a purpose. Okay. I want to just bring awareness to the purposeful use of these products, and then share a little bit about the pros and the cons to make sure it's right for you. Another option is surgery. So there's a couple different types of surgery that can address snoring. There's the UPPP, so UPPP, uvulopalatal-pharyngeoplasty. Okay, it's a hard word. I probably didn't even pronounce it right. That's okay. And it's a procedure where a surgeon will remove all of the tissue from the back of your mouth and the top of your throat. So the tonsils and adenoids obviously are removed at that time as well, just opening up the airway. There's jaw surgery known as maxillomandibular advancement. In this procedure, the upper and lower parts of the jaw are moved forward compared to the rest of the facial bones. And this enlarges the space behind the tongue and the soft palate, making obstruction less likely. There's a surgical opening of the neck, known as a tracheostomy, You may need this form of surgery if all other treatments have failed and you have a life-threatening obstructive sleep apnea. During this, the surgeon makes an opening in the neck, inserts a metal or plastic tube for breathing, and air passes in and out of the lungs, bypassing the blocked throat. Okay, so all of these are very invasive surgeries, and although they may increase the size of your airway, they can reduce your immune function if they do not address a habitual issue, and you may end up still snoring or waking up unrested. And lastly, the CPAP machine. So they come in continuous pressure, auto titrating, or a bi-level. And yes, they work. And I would never, ever say to stop using it. It affects our mental health as well, our brain health. However, is it actually addressing your root cause? I have to say no. It's a treatment option to the symptom that you have. Okay. And if you're unaware, proper cleaning and maintenance is important as well. Otherwise, you can compromise your respiratory health. Okay. You don't want microorganisms living in there, and then you're breathing that in and potentially increasing problems related to things like asthma and reactive airway disease or other lung conditions. Okay. The good news is this is uncommon. People generally take good care of their machines, but it is a risk. So making sure that you're maintaining your CPAP is a vital aspect to using it. Okay, so there you have it. Some pros and cons of the traditional approaches to address snoring and sleep-related conditions. So these things, as I mentioned, have a time and a place. And it all depends on a person's knowledge of available options, their finances, practitioners around them, time, and their values. All I know is that I've worked with people who've attempted these various approaches, and yet they still find me because they aren't happy with the results that they've experienced. So now, let's think about why you assume you snore and you can't stop. Think about that for a little while. Why do you think you snore? This slide, I'm going to share the three main reasons that people will come to me and say, and that is weight gain, stress, and alcohol. So they are absolutely contributing factors. So if you guessed any or all of those, then you are correct. But there just happens to be more to the story. So if this is you, you might have tried to change these aspects of your life already, but it never changed the fact that you snore. And this is where I can come in and shed a little bit of light on this concept. So weight gain. Increase in your body weight can put more pressure on your lungs, making it harder to breathe. It also increases the diameter of your neck and your tongue. So because the neck and the tongue, weirdly enough, carry excess fat, which then obviously reduces your airway size and creates more disturbance and a vibration in the loose tissue where the airway would otherwise flow. And then over time, that increases inflammation in the area. And any form of increased inflammation adds to your systemic burden on your entire physiological stress. Which then brings us to stress. Stress can be emotional, it could be psychological, physical, or physiological, like digestion and repair, organ function based. Okay. When we are stressed, we are not allowing our body to experience rest and digest nervous system function. Therefore, we're just pumping out more hormones to attack a perceived threat. Day and night, no matter what, you're never going to feel rested. Okay, the cortisol is just pumping through your system. And lastly, alcohol. People often snore after a crazy night out. The body is doing that because it's trying to take in oxygen to improve blood and cell function. And the fastest way to get that is through mouth breathing. And snoring is often a habitual mouth breathing habit. So alcohol can potentially be the root cause. But if you always snore, but don't always drink, then it might not be your root cause. Okay. A little addition as to how drinking can affect our sleep. You might think having a drink before going to bed will help you, but it's similar to sleeping pills. It might help you fall asleep faster, but when the drug runs out, your sleep cycle is negatively affected and you never get into the full deep sleep that your body needs. So here it comes. The real reason why all of these actions and products that you've tried before to help your snoring problem hasn't worked is because you likely haven't addressed your root cause. So, what that is the strength, endurance, and function of your tongue and the facial surrounding muscles. Okay, this is something funny that I heard or something I thought was funny when I heard it. You should eat through your nose as much as you breathe through your mouth, meaning you should not mouth breathe. Unless, of course, it's a survival function, then by all means, breathe through your mouth. So if you're mouth breathing and snoring all night, your body is in that survival mode that I'm speaking of. It's not rest and digest, which it needs for better heart and brain function during your waking hours. Okay. So why does mouth breathing lead to snoring? Well, perhaps it was a habit of mouth breathing because you could have been mimicking your parents. If you look back, do your parents mouth breathe? Or was it out of necessity? You could have had childhood allergies and illnesses that prevented the ability to nasal breathe. But regardless, the habit eventually becomes carried throughout life. It impacts your facial structures as you grow because your cheek muscles pull in, creating pressure against your upper jaw, and therefore you get smaller, underdeveloped upper jaws. The weight of the tongue falls down as well onto the floor of your mouth. And then when your upper jaw is potentially smaller, your sinuses are affected. You can end up with deviated septum and underdeveloped sinuses. Okay. And not to mention then that the jaw being forward, it sits in the little joint, not wrongly, but it sits and puts pressure on the joint, affecting your forward head posture. And all of this is the base of the skull, which then affects your entire spine. And that pulling forward of the jaw can also block off part of your airway. So it leads to difficulty in breathing function, which progresses to greater blockages and irritation and inflammation that progresses over the years. You might even, as time goes by, hormonally, it's generally considered the reason, but insomnia in our 40s, 50s, it becomes more severe because if you consider that every night you go to bed and you're not getting the oxygen you need, your brain has a survival mechanism to keep you alive, and it thinks every night you're being suffocated, you're going to die. Your brain does not want you to go to sleep. And so it will do whatever it can to keep you awake, often racing minds. So increasing nasal airflow with strips is great, but if your airway is constricted lower down or your mouth is open and the air seeps out, then you're just not sustaining your oxygen needs. And if your sleeping pills are knocking you out, but you're not breathing properly, same thing. If your oral appliance is encouraging mouth breathing, same thing. They're treating a cause, not the symptom. And that's why you might just never feel like you're getting the results that you're looking for. So concept 2 now was how to stop that sleep roller coaster. And if you're wondering what I mean by that, like most people I encounter, they've tried everything to stop snoring, but they come out feeling even more defeated from ongoing fatigue and anxiousness. Nothing gives them the results they're hoping for. They find the best thing to do is to sleep in a separate room from their spouse in order to save their marriage. But what does that do for you, the snoring partner? You sleep alone, feeling more lonely and depressed while you embark on the sleep roller coaster of trying things over and over again, eventually just feeling like a failure. Your mental health becomes affected, and you start to begin to think that something is actually wrong with you. But I'm here to tell you, it doesn't have to be this way. Okay. I know that you've done everything right. It's because you're here now. You keep looking for an answer. You're never giving up. And I know that just because you didn't get the results that you were promised in other things, that it wasn't your fault. Even the medical, dental, and naturopathic community is still getting it wrong, or at least not quite right. So science has proved that the medical and natural remedies can help, that routines and sleep hygiene might help, that appliances, machines, and surgery will help. But for how long and to what degree? If you keep researching, the science also proves that they might not have lifelong efficacy, and they can come with potential side effects, not to mention the limitations in real life applications, which tend to be less than desirable, which I'm sure you know of and that you've experienced it yourself because you have tried it all already. But you still know that there is something missing. And maybe there is. What if there were techniques and exercises that were proven to stop snoring? Are you ready to assume that you've tried everything and believe nothing has worked for you or will? Or are you ready to prioritize time to the one thing that finally can? So, a little continuation on here, um, in case you are curious of that thing that can, um, just in case you're skeptical. Your brain will override your hope and you will roller coaster back into belief that something is wrong with you, that nothing can help you. You'll continue to believe the misconceptions about snoring and the actions to reduce it. And if you continue to believe this way, you will be right. Okay, because you won't take the action to change your mind. And that's really where this change will occur, is with a mindset shift. Okay, so let's dive into some current beliefs that are preventing us from getting the results that you're going to want and that I have possible for you. So, one misconception is that sleeping pills are just going to get me the sleep that I need that's required. Well, if you become reliant on these, you are fearful to stop and that you're fearful that you might not get the sleep you need. But the fix is don't worry about the sleep quantity. Let's focus on sleep quality. Okay. Another misconception, not necessarily misconception, but another thought that we have in our mind is that if I don't use these nasal strips or pillows or mouth tape, my relationship is going to suffer because at least when I'm using these, my spouse knows that I'm trying to stop my snoring. It's just that nothing has worked. But the fix is there is a way that a lot of people are unaware of that can stop your snoring without those gadgets. Another thing that stops us from getting the results we want is we think that an oral appliance is the best option because I already grind my teeth and I don't want to ruin them more. But the fix, stabilize the jaw, strengthen the tongue to do it naturally. Okay, support your jaw and use your tongue as your oral device. Another thing that might get in the way is we're at the point where we think surgery is the only option. Okay, I'm just gonna, sorry, put my nose a little bit here. Um, if you've tried everything else, you just feel like, no, I have to do surgery. That's the only option. But again, rather than cut out anatomy, let's tone those airway muscles. Let's open those up naturally so that way you don't have to remove vital functions of the throat or vital tissue in order to get that airway open. And a last thing that stops a lot of people from really making the step to stop snoring is CPAP is the gold standard. And it saves lives. But if you're mild to moderate sleep apnea and you don't need this, why wait until you're finally diagnosed, right? Let's change that mindset. Let's prevent the collapsing of the airway in the diagnosis in the first place. Okay, so even if you get past those misconceptions and understand that your options are better by making this new change that's out there, there's still a part of you that feels that you're not worth it. Okay. You might think it's wrong for me to spend money on myself. It probably won't work anyways. I should be focusing on my kids. But prioritizing yourself is important so you can be there for your kids. It's like on a plane. You put your oxygen mask on first, because if you're not there to put your kids on, everybody loses. Okay. And lastly, you might not feel like you're worth it or it's worth it because you're already exhausted and overcommitted to life, you'll find it too hard to stick with the plan. But I will show you exactly how to get the results that you want, even when you're busy, if you travel, or if you're extremely tired. Okay, so listen up to what I'm going to share with you. It's the new way to stop snoring and inadvertently save your marriage, lower your blood pressure, improve your cognition, and reduce your risk for things like heart attack, stroke, Alzheimer's disease. And then as a side effect, maybe even look and feel younger. So the third concept was the discovery that I made by accident that changed everything for me. So the reason you showed up here is because you want to stop snoring and wake up feeling rested. And here's what I have discovered that works. So during my journey, I did take the long way around. I was trying to connect the mouth with the body in terms of my clients' oral health deteriorating despite all of our hygiene efforts. That led to understanding oral signs of dysfunction, which cause teeth grinding and jaw pain, and the mouth's effect on our sleep. And then it was when my newborn daughter was diagnosed with sleep apnea that I knew that there was more to this sleep story, that there was something we were overlooking when it came to snoring. A newborn was not dealing with stress, caffeine, or intoxication. There was something else contributing to that snoring. So once I continued my studies and learned a therapy to address the oral dysfunction, I happily stumbled over my own health improvements. I had better concentration and memory. I was less anxious and irritable, and so was my partner. And we were both sleeping better because I was no longer snoring. So you have to address the root cause, which is the muscles of the tongue and airway being weak or dysfunctional. So what you need is a proven method, a step-by-step plan in place, especially because you're tired. That's going to address the root cause so you can stop doing all the things that don't work and just focus on the key elements that do. I discovered that in order to strengthen my mouth and face muscles so that I worked optimally, and what I found working through myself and with my clients is that there are 5 elements that are so important. The awareness of the root cause. So hopefully you've downloaded my lead magnets, is what they call it. It's a guide to find out why you're snoring. Okay. I find the most important aspect to make us make that next step to make a change in our life that really matters. We then need a step-by-step plan that can teach you what to do. Okay. We also need alternative options, like special touches, like daily routines or rituals or support in a relationship, um, or like little sleep hacks, I should say, right from nutrition to mindsets and gratefulness. Okay. You also need to have accountability, a sense of community of like-minded individuals, and that support that you need to know you're not alone and that it's getting better and you can share your information with people to keep you motivated. It's a huge part that's lacking in today's world. We're very isolated individuals at this time. And then lastly, a professional that answered my questions and provided ongoing support was so important for me. And I had a lot of questions. So I just find that these elements are crucial to reach your goal, and why I decided that I wanted to offer my expertise in a way that could support people in all of these areas, to have a more beneficial approach and ability to reach their goal. So I chose this picture in my presentation because when I first tried to do the plank, I couldn't lift my legs off of the ground, let alone like straight off of the ground. But with a little bit of practice every day, eventually I got it. So it was the accountability that mattered more than the years that I had done tricep dips and crunches and protein rich diets. Sure, they help, but it wasn't the right approach for what I needed. Okay. So when I noticed that most of my clients were people who were advocating for themselves after years of being gaslit by their healthcare team, I knew that I had to get this information out. I got a little note here. Oh, yes. Okay. I had to get this information out. But even that wasn't enough because after figuring out the way that I was helping people assess their symptoms and get the results they wanted, I also realized that access to care would be the next barrier for the greater population that required these services. Therefore, I needed to provide stepping stones to keep the momentum going because I knew in my heart that there was a way to conquer sleep issues, gain confidence, increase mood and energy that was directly related to sleep and snoring specifically. I knew all the tools necessary to get better sleep from my formal training in myofunctional therapy, breathwork courses, and my wellness coaching certification. And so it was the unique combination of all of these that helped me create my system to tackle snoring from a habitual, environmental, anatomical, and physiological standpoint. So I was able to help people stop snoring and wake up rested. And as a side effect, I also help them gain confidence, lose weight, improve digestion, memory, focus, create more intimacy in their relationships, and reduce chronic pain that they had in their head, neck, and shoulders. I knew that I had to make the process available to everyone because the results were too good and the effect of not improving snoring is devastating. Okay. And that's what brought me to where I am now. I couldn't ignore my role, my mission, my purpose in this arena. I took all of my work and cherry picked the exact aspects that were getting my clients the results that you're looking for. I added some information from all areas of my professional backgrounds, and I curated an opportunity to personally motivate each and every one of you to getting the results that you want. Okay, here are some examples how the work can finally help you too, just to see if any of these resonate with you. Example one, I had a client who saw massage, physio, had Botox, CBDs, pharmaceuticals, psychological analysis, neurological support. And yes, she literally spent thousands of dollars and hundreds of hours trying to get better sleep, more energy, and rid herself of her debilitating jaw pain. She was skeptical that I could help her, but she had already done so much that she actually feared not trying it in case it was the one thing to solve her problem. Her big obstacle was that she was already exhausted and wasn't sure if she could commit. But with the accountability and flexibility that I offered, she had to try. And within the first 2 weeks, she had relief that made it easier and easier to do the work that was needed. And it's not a lot of work, but I know that when you're tired, the simplest things can feel really big. So my second example is after trying nasal strips and dilators, chin straps, and a special pillow, my client's wife moved into the other bedroom. She was so frustrated with her husband snoring that the broken sleep that she suffered, despite her feelings of loneliness, was the better option for her. She discovered myofunctional therapy after sleeping in her own room for a couple years. And her and her husband talked it out and he agreed to try it. And we worked together, and I can happily say that he shares his room with his wife again. Sorry, I got distracted because I had a phone call coming in and my kids are at daycare, so I wanted to make sure it wasn't the babysitter. All right, and my last example, I actually brought up his example earlier in the presentation, I realized. It was someone who traveled for work frequently. He always had the ear issues, and he was just finding that it was all really becoming disruptive in his life. So he was clenching more, getting more headaches and jaw pain, despite all the psychological and physiological treatments like meditations, cold dips, chiropractic care. Nothing seemed to settle his symptoms. And then he came across the link between these symptoms and his snoring. And that's how he found me. He had a busy life, but decided to try it anyways. He just, in a way, regretted that he didn't find me sooner. And with only 2 months of working together, he was flying without regular pain, that he was suffering from his tinnitus. We worked together for a little while longer, addressing other key areas in his life. But he can gladly say now that he is sleeping better, he stopped snoring, and he eventually pursued his passion and became a specialized coach to help others with anxiety and mental health. So let's review the 3 concepts. Okay. Core concept 1 is the real reason why what you're doing isn't working. And what we learned is that we discussed the many how to band-aid a symptom and how those can come with side effects, discomfort, and loss of efficacy over time. We also discovered that there is a different approach to snoring, to not be focused on treating a problem, but to consider the root cause and focus on that instead. Core concept 2 is a sleep roller coaster. That you now understand that all your attempts to solve your problem were not failures. You just never found the right one for you. A little side story of a quote that I like, because I'm quite tenacious about certain things that I'm passionate about, despite the challenges that come up. I just keep on trying. So this quote was from Thomas Edison, where he made 1,000 attempts to invent the light bulb. Yes, 1,000. But he didn't stop searching, and he certainly didn't consider them 1,000 failures. He actually said, I have successfully discovered 1,000 ways to not make a light bulb. And we're not sitting in the dark here, are we? Well, maybe some of you guys have the lights off, but you know what I mean. There might be something we needed to learn before we got to where we wanted or needed to be. And then the core concept 3 was this discovery that I made by accident, and why all of this is just so powerful. I walked you through the exact method that I used and that I use with my clients to help them stop snoring. What I do to help them wake up feeling rested and no longer embarrassed and anxious about travel and social events, and to even help their relationships. And that was a systematic group of exercises for the tongue and face muscles, as well as breathing techniques, sleep hacks, and rituals to help get you a restful night's sleep. So you showed up here today because you want to stop snoring so you can wake up feeling rested and less irritated. You want to get restful sleep so you can wake up with energy to enjoy your kids, have a better connection with your partner, and have more energy to work out and complete tasks efficiently. You might want to start a business or whatever it is that you're dreaming of, really. Basically, you're looking to achieve success, whatever that looks like for you. A recent quote came up. I don't know who made this, but it said, a healthy man has 1,000 dreams. An unhealthy man has but one, right? Because our health is so important. When we don't have it, nothing else tends to really matter. Okay. You also, sorry, I get off track sometimes. You're also looking for a simple way to improve your memory, your confidence, your life, without having to repeat and reread everything. And of course, to never waste money or that limited resource of time on gadgets and Google searches and reviews. And basically, you want to find a proven system that can create results that last. So at the beginning of the training, I made you a promise. I promised to show you how to stop relying on products and appliances to improve your sleep, so you and your partner can wake up feeling completely rested, even before the alarm. Now, here's the thing. I want you to remember, everything I've shared with you today isn't a random theory or some idea that I think might work for you. Everything I walked you through today works. It's worked for me. It's worked for my clients. And we all started from a similar spot where you are now. I'm not special and they're not special. We all have busy lives with crazy amounts of obligations from family and work. And if we can do it, I'm so confident that you can do it too. You already know that you can achieve your dream of no longer snoring and waking up rested, as long as you have the accountability and the right plan to follow, which you do. So you're already halfway there. So I have a question for you. Would you like me to help you stop snoring? Okay. So you do have a choice now. You can continue to do what you're doing, waking up feeling discouraged, anxious, embarrassed, irritated, because you just had another poor night's sleep, hoping that it all works out eventually, even though it never has before. Or you can choose the simpler path and use the Stop Snoring Solution program that comes with a proven system and accountability so you can finally reach your goal. Okay, the choice is yours. Now, throughout this presentation, you heard me mention a solution, the stop snoring solution. And this is how I can help you achieve a restful night's sleep without gadgets and products and finally stop your snoring. Okay. My job is to give you the right information so that you can stop snoring without struggle and more failed attempts. Or, as I mentioned earlier, more successful attempts of finding what doesn't work. So, you're here for a reason. And I purposely make this presentation long because I want to weed out the people who aren't ready to work with me. If you fall into that category of no, you don't want to work with me, or you haven't made it that far in the video, then well, if you made it this far, you're listening. So if you don't want to work with me, I still commend you for taking this time for yourself and learning and educating yourself on something that could potentially help you. All right. And if not now, maybe in the future, I'll be able to support you. So for those wanting to stick around and see how I can support you, okay, here's how I can support you. First, it starts with a call with me, okay, a snoring assessment call. In there, I take 30 minutes or so to gain as much confidence in what you're dealing with and knowing that I can be the one to help you. Okay. You'll be able to see how the system works. And you're probably even going to think, how is this call for free? You should be charging for this. And most therapists do now charge for their consult call, even. Okay. So putting that out there, while I'm not the only myofunctional therapist out there, there are a lot of people doing this now, which is great. I'm reaching out to you because of my unique background working with people who snore, that want to wake up rested without using products and devices. And I do this because I focus on the specific need that you have while supporting you with the accountability and a motivational framework that you need. Okay. I transformed my own life, my clients' lives, and so hopefully I can help transform yours as well. Okay. So there is a link here. Well, this is just a video, so I'll put a link in my notes attached to this video for easy scheduling. But it is mindbodymouth.jnap.com. And I'm two businesses. I do dental hygiene. So you'll have to scroll down to the Mind Body Mouth link, and it will bring you over to this page that's on here right now. Okay. And then you just book a snoring assessment call with me. And that is what it will look like to do that. And then after you do schedule that call, you'll get email notifications for the appointment, as well as a few reminders that I will send out personally for you. Okay. The calls are done over Zoom on a secure JNAP system. And I'll admit you at the start time. And you don't even have to have your camera on if you don't want to. Okay. So now that you've seen how to schedule the call with me, I want to cover a couple specifics. I'm going to help you recognize why nothing has personally worked for you and provide you with a unique plan intended to help you stop snoring so you can finally wake up rested. Okay, we'll get specific on your goal and why you want it, any obstacles and challenges that would derail your success, how to handle social situations or pressure, and any self-sabotage that is happening. Okay, this way, by the time the call is over, you'll leave with a helpful strategy that can propel your success. Okay, here's the important thing to know. Okay, this call is 100% free. Okay, now you might be thinking there must be a catch. You just told me the ways that you're going to help me. How could this be free? So, first off, the call's free because it is my mission in life, like literally my life's work, to support people and their families get restful sleep in a way that doesn't involve all these gadgets and meds, right? Remember, it was my daughter who had the issue that was too young for any intervention. And so I want to raise awareness of the issue and the possible option for preventing snoring. So just meeting with me will help get this information out there to those that are ready to make the change that they need. And it's a core value. Anyone who knows me personally or from my dental hygiene practice and that I've treated so far knows that it's my integrity, it's my value first. So just offering that value and helping you is really what matters. Okay. This is my own personal business, it's my integrity. And so I know that I can help you overcome some barriers that have been stopping you from achieving that restful sleep in a short period of time. Okay. So that's why I make the call free. Okay. And second is that I know there are so many people out there listening that want more personalized support and accountability than a regular myofunctional therapy program might offer. Okay. So if you're someone who knows that in order for you to succeed, you need that, then great. We can discuss the next steps on the call on if I'm the right fit to be working with you and if the Stop Snoring Solution program is an option that I think you would benefit from. Okay. And if it's not, like that's completely okay. You'll leave the call with so much value and clarity and confidence that at least I have the honor of serving you. Okay. And we can just be friends. Okay, wait. There is one catch. Okay. I don't just want anyone and I don't want everyone. Okay. The call is not for you if you're not ready to take responsibility for your success. Okay. If you don't value your health and well being, if you're not open minded to a new way of doing things, or you're not ready to prioritize your snoring issue. Okay. I'm not saying this to be mean or rude. We all have circumstances in life that prevent us from taking actions towards any opportunity that arises. This is no different. And I only want to work with you if you're ready to say yes to this now, because it means you're ready to prioritize your snoring and your change and say no to something else. So, if this is you, if you're someone who wants the support and accountability so that you can sidestep all of those obstacles that used to hold you back, then make sure you schedule a call right now. um, I don't have a call center doing things. You and I are going to jump on the phone together, or on the Zoom, I should say. And I'm going to do my absolute best to support you. Okay. So even if you've tried nasal strips and oral appliances that are specifically intended to stop snoring, yet it hasn't worked for you, know that this does. Okay. It works because it's based on a holistic approach to care utilizing modern day science, medical, naturopathic, and Eastern philosophies, and it includes support and accountability that traditional methods don't. Because of my background, values, and experience, there are many factors involved in traditional programs um, that just aren't covered, like community support, regular accountability, motivational components, and additional resources and guest speakers. And we are multifaceted beings. And I like to take your whole self into consideration when helping you meet your personal goals. Okay. So head over to the calendar, make sure that you secure a spot for the stop or the snoring assessment call. And there's, I really want to stress that there's a big difference between trying to figure this out all on your own and working with someone who has a track record of success. Um, oh yeah, I already kind of covered that part. So I'm going to cover some common questions in advance that I often come across. Um, so question one, I've already spent so much money trying to solve my snoring. Should I still book a call? Well, the answer is yes, it's free. Okay. Then you can decide if my methodology is an investment that's valuable to you. And the way that I look at it, everything costs something. So the cost to do treatment and the cost to not do treatment. So it's costing you sleepless nights, it's costing you pain, it's costing you marital problems. So, really, what feels more expensive to you? A done for you program, which is an investment in your health, or nothing changing at all, except maybe the reduced quality of life that continues on. And question 2, well, I need to discuss this with my spouse. Should I still book a call? I actually encourage you to bring your partner with you. They're obviously witnessing your struggles and your challenges, and they love you. And I assume they want you to find a solution if possible. They can learn more about what you're going through. They can understand where I might be helpful and how they can be a supportive member in your journey. And not to mention, if you stop snoring, imagine how much better they will sleep. Question 3, I'm really busy. Is this a lot of work? Well, that's kind of a tough question to answer, and that's why I wanted to cover it here, is it comes down to your priorities. I can't really decide if it's a lot of work for you or not. If you're too busy to make a call, then I would think that your symptoms are not affecting you enough to try to change your behavior and therefore your future outcome. So I'd suggest not booking a call because it's not a priority for you. It's not affecting you enough to make the change that you need or want. However, if you are busy and you want to function more efficiently to be able to free up more time for more important aspects in your life, because sleep is such a major factor in success, if you're not improving it, you're actually making your life maybe more busier. So, and that's because you're not as efficient. So, if your priority is to sleep better so you don't feel as busy and you want to improve your snoring, then book a call. Question 4, I am scared because nothing else has worked. Well, fear is a real thing, and it holds so many of us back from success. So maybe this won't work for you, but you don't know, and I don't know. But honestly, I don't really have clients that it hasn't worked for. And Sean Stevenson, a sleep specialist, once mentioned the chains of habit are generally too small to be felt until they're too strong to be broken. So maybe ask yourself, is your snoring a habit? Is your mindset of failure a habit? Is your fear a habit? Do you want to break the chains before they're too strong to be broken? If your answer is yes, then book a call. See if I can help you. And the biggest one that I hear, and it's saddening and maddening, why has no one told me this before? Well, first of all, I'm sorry that it took so long for you to become aware of it. And it is frustrating that no one else has mentioned it before. But I understand because I didn't know this 10 years ago either. And if you weren't aware, doctors get 1 to 1.5 hours of education on sleep, yet it's a third of a person's life. It's so important, and it actually happens to be a major neglect in their own life. While they, think about while they studied all those night shifts and the fact that they continue to shift work and do ongoing shifts, like whatever it's called, where they like back to back shifts. Um, so sleep has never been prioritized, even in their educational system, for them to care for their own selves. So then after school, if they're not up to date on sleep science, which many aren't, because if you don't have a desire or need to look more closely at sleep because you're not someone who's personally affected by it, then they just never end up knowing, right? You have to remember that your healthcare team members, they are people too with busy lives and families of their own. So again, if they're not specifically affected by it, they're not looking into it much further either. They're just following whatever continuing education courses fall into their lap or their area of interest, right? So that's why you might not have heard of this before, but it's becoming more and more aware, and we're going to hear about it. The more this information gets out there and the more people can talk about it, then yeah, this is going to be an option. And I really should have included this in my presentation, but on a sleep study, when you end up being diagnosed with sleep apnea, one of the recommendations is to optimize your airway. That's what I do. That they don't specify myofunctional therapy, but that is what it's alluding to. It is how you can reverse it. And there are proven studies to show that you can stop your snoring and you can reduce your sleep apnea events through myofunctional therapy. And so my program is a form of myofunctional therapy. It's based on myofunctional therapy along with the other holistic aspects that get you the results that you're looking for. Okay. So that was a bit repetitive. But, anyways, you did it. Thank you so much for watching. As I said before, it's been my mission, it's my purpose on the planet right now to save people from having to experience what I had to deal with myself, with my baby, so people can just wake up feeling rested and have a healthier, happier life. So if you end up booking a call with me, I can't wait to talk with you. That call is all about me being of service. And if we agree that we're a right fit, then we can discuss how we can work together. And either way, I hope you get so much out of the time that we've had together now or on a call. And I look forward to sharing more information and more support to you as time goes on. Thanks again. Bye.